All right. So for my part, I'll be discussing genetic counseling process and how the process is critical for providing information to patients and families and providing the information that they need to know regarding the genetics of their diagnosis. And I have no disclosures to provide. So throughout my part of the discussion, I'll be presenting the important values innate to the genetic counseling process, as well as the main components of a genetic counseling session, how they relate to each other, and their influence on how patient and families receive the information that is provided during genetic counseling, as well as examples throughout. So to be clear, while genetic counseling might be complex and nuanced, I do think that we can sum it up into two main objectives in two different categories, as in client education and non-directive counseling. So we want to provide our patients and their families with all the information that we think that they need, as well as the information that they want, so they can truly make informed decisions that is best for them in their specific situations. And so this is very difficult to accomplish without providing non-directive counseling. And this means that you're providing information without bias, without regard for your personal opinions or beliefs about what that information should be used for. And so we could have a whole discussion about non-directive counseling and how that could play out in various different scenarios, but it'll just have to suffice it to say that in general, non-directiveness is the goal and the gold standard for providing client education. To accomplish this, a genetic counselor, whoever's providing this information, must be able to recognize that there are a few important factors about this process. And so you must respect the patient's autonomy, which means that they are free from external influence, which is where the importance of non-directiveness comes into play. And being able to provide an atmosphere of confidentiality and privacy so that the patient feels comfortable giving you personal information about themselves. And that is critical because without that information being shared, sometimes can make the difference between the decisions that they make in the end, because you can't address something that they're not going to share with you. And then, of course, also recognizing the psychosocial implications throughout the entire genetic counseling process, that the information that you're providing will have an impact on them. And so with these values in mind, the rest of my discussion is going to be focused on these 6 components of genetic counseling process. Understanding how these relate to each other and the importance of each one will allow you to provide the most efficient and effective information that's important for your patient to know. And first is contracting. And so in contracting, imagine that if you and a friend go to the movies, and as you approach the ticket booth, your friend is asking for a ticket for the newest horror film, and surprised, you interrupt your friend and say, well, I thought we were going to go see Star Trek. And obviously not the same thing. And so you realize you didn't communicate very well what it was you were actually going to do. You knew you were going to go to the movies, but you hadn't actually discussed the film you were going to see. And so you didn't discuss your expectations for your time together. And so this is where contracting would have been extremely helpful. In contracting, you recognize that you are entering into a relationship with your patient. You recognize that in this relationship, not only do you have expectations and goals, but for what you want to happen with your time together and in your relationship, but so does your patient. They have their own expectations and goals that they're bringing with them. And so with contracting, you're going to make sure that everyone is on the same page for how this relationship is going to play out. And it's important that you, as the genetic counselor, the person who's providing this information, initiates that conversation so both parties have the opportunity to share their expectations and their goals, and that there aren't any surprises about where your relationship is headed. And you're basically, when you're making those expectations, you're making a plan for the rest of your time together. And that some suggestions and some strategies on how this might happen, you can simply just ask your patient about their understanding about why they're there, or about their concerns about why they're there for genetic counseling or for that appointment. And using the patient's own words, their verbal information they're giving you, and their nonverbals, the way that they're sitting, words that they're using, how they're the tone and their voice, to assess emotional state and the level of their understanding, which is going to help you assess those psychosocial concerns throughout as well. And then being able to translate those statements, the responses they give you, into specific goals for them, putting into words maybe what they were unable to do from the get-go, so that you're working towards a mutual agreement for your time together. And so basically you're entering into this relationship with your patient as you would anyone else. You're going to start with a short conversation. You introduce yourself by name and by your role, addressing time constraints, because that can be very important if you are short on time with many of your patients, so they don't feel that they're shorted the time with you, and assessing their understanding and prioritizing their goals, because that's one of the most important things, is to make sure that their expectations and goals are met. And these are just some examples of how these might play out. So, for example, good morning, my name is Jennifer, I'm a genetic counselor. One of my roles is to discuss the genetics of hemophilia, et cetera. Or just simply moving on and saying, can you tell me your understanding of why you were referred today for genetic counseling? And then we have information gathering. So information gathering is exactly what it sounds like. You're going to be gathering a lot of information in your time together, but it's broken up into three main types or categories of information. So first, the clinical information, which is basically your standard data that you're going to get, their personal medical history, their bleeding symptoms, treatment history, et cetera, things that you might have been able to get from medical records, but it was important to verify with your patient as well. And then there's the family history. We could have a whole day talking about family history. It's a very important part of the entire process. But the best way to gather information for the family history is by constructing a pedigree, which we have a couple examples at the bottom. And there are standardized pedigree methods which are used, and they're found in a couple places like the Journal of Genetic Counseling, or in a genetic counseling book called A Guide to Genetic Counseling by Wendy Ullman. And it's best to use a standardized method, because you want anyone else who's going to look at that to be able to interpret the information just as it was meant to be, so that you're not using your own shorthand information or symbols, and it's not carried on towards, if it's going to change between patients, it's difficult to know how to interpret the information. And throughout the information gathering process, you're likely going to, through the family history, you're likely going to uncover some important social dynamics within the family as well, whether or not someone's adopted in or adopted out of a family, whether some people don't talk to this side of the family anymore, or you're going to see, who might be a carrier, who's at risk of being a carrier, and all these people that are important to talk to, but maybe they don't talk to them. And so you can figure out through the family history how you're going to address these concerns later on when you're talking about this information. And then there's non-clinical information, and so we kind of touched on that in family history, but this is basically the information that is going to, the other factors that might impact client or your patient's decision-making process, including their understanding of how hemophilia occurs, and the familial implications of the condition, as well as other psychosocial factors. So, for example, what can you tell me about your understanding of hemophilia? Or maybe recognizing, validating, you already know a lot about hemophilia. How did you learn this? And kind of get a feel for how they prefer to learn about information, which will help you when you're providing information, whether it's through support networks or internet or email or brochures. Or what do you think having a child with hemophilia would be like? Have you thought about how or when you might tell your daughter she's a carrier? So these types of questions, getting the non-clinical information, are really going to help you tailor information that you provide later. And these last two questions also touch on another aspect of genetic counseling that's very important. That's called anticipatory guidance. And you can see these are questions that it's going to help you in terms of how you provide information, but it's also going to help the family and the patient, because you're posing for them, possibly for the first time, hypothetical situations that may or may not happen, but are likely to happen. So this allows them to begin processing these scenarios in a safe place where they're allowed to ask questions before they occur, so that when they do happen, they're much better equipped for it. And then there's risk assessment. So in risk assessment, this is where you're going to take all the information you've already gathered, the clinical, the non-clinical, family history, and applying it to the information you have to provide to your patient and their family. So the genetics, inheritance, natural history, all of this information, taking into account your previously agreed upon goals, the level of understanding you think that they have based on what they've provided to you, cultural and worldview differences, personal experiences with the condition. All of this is going to affect how they perceive and receive the information you're about to provide, and should affect how you deliver that information as well, because it's not effective to deliver information for the same way for every single person. It's not helpful. We don't all receive information the same way. So some of the information that you can provide in the risk assessment, of course, is, maybe the usefulness of previous tests. So if they mention somewhere about having factor level testing, just so you're aware, a woman can still be a carrier even if she has normal factor levels. Or maybe the probability of having hemophilia or having children with hemophilia. So letting them know that based on their specific situation, maybe having no history of hemophilia and the only son with hemophilia, the mother has basically an 80% chance of being a carrier herself, and providing the information in a way specific to their situations. That was also ideal testing strategies. So for severe hemophilia A, perhaps only testing the intron 22 and 1 inversions first, etc. And so some ways that will help for a risk assessment, different ways, is before even providing information, just asking them what they think their risk is. So sometimes finding out that a woman thinks that she's an obligate carrier, basically, when really there's a 50-50 chance, perhaps, can help you deliver that information differently than perhaps if she thought her risk was 0, or using different formats of risk. So instead of always using percentages, maybe using percentages and fractions, or even using descriptive methods, like if you have 100 women who have sons with hemophilia with no family history, 80 of them will be carriers and 20 of them won't. Just different ways of presenting the information. And then patient education. And of course, patient education and genetic counseling sessions can be the most substantial portion of the genetic counseling session. So this includes not only just educating the family or the patient, but the family as well. And so based on how the patient has had personal and family experiences with the condition and cultural understandings, how illnesses occur in general can help you figure out whether you need to spend more or less time addressing misunderstandings and misperceptions. Because if there are any of those, it's important to assess those and tease those out so you can address them while they're still there with you. And taking into consideration everything that we've talked about before in terms of level of understanding. And so patient education includes the natural history of the condition, their perception. Knowledge can impact how they react to that information, identifying areas where they might need more education, going through the etiology, symptoms, management, treatment, inheritance, and genetics, going through all of the information at varying levels of depth depending on their level of understanding and desire to know, and then testing options and family planning options as well. So for testing options and genetic testing, trying to explain genetic testing in a way that's easy to understand can be very difficult. And genetic counselors especially spend all 2 years of their training trying to figure out the best way to provide that information in an easy to understand way, and it's still very difficult. But it's don't give up after several times. It might be awkward, could take a long time, but eventually get to a point where that becomes very comfortable, and the explanation is always going to change depending on your patient and the families, depending on what they need. But in general, like a gene is like a word, and genetic testing is like a spell checker looking for misspellings, and of course those misspellings are the mutations or pathogenic variant identified. Changing your language to meet your patient's needs. And then genetic testing options sometimes lead into family planning option discussions. So talking about adoption, termination, prenatal diagnostic testing, NIPT, IVF, depending on what resources are available to you and your families. Giving them the information without deciding beforehand maybe that they shouldn't proceed and choose a particular option just because you don't agree with certain ones, allowing them to make that decision for themselves. And then psychosocial assessment and counseling. And just like some of the other components of the process, this doesn't actually just happen in one, even though it's its own category, it doesn't happen in one setting. It's happening throughout the entire time you're with your patient. And one of the most critical pieces to genetic counseling that can either enhance or hinder how the information is received by your patient. This is because their psychosocial state can affect how they respond to the information that you're providing, such as providing a new diagnosis, or even if they've had a change in their family or life situation, they might not be listening to a word you're saying. Might be not something that they're ready to deal with right now. And so being able to recognize and address these psychosocial states of your patient can help them receive the information more effectively and efficiently. And by doing so, your patient should feel very supported. They should feel free to express their own feelings and thoughts and concerns, and to reach their own decisions, again, by yourself being non-directive and by providing the atmosphere of confidentiality, privacy for them to feel free to do so. And one of the ways that you can do that is by figuring out first what sort of network do they have, what sort of support groups do they currently have. And it can be more than just asking, what support group do you have? But it could be trying to figure out, well, how would your husband feel if you had a son with hemophilia? And getting an idea of that reaction that would elicit from him, because that can help you understand better the kind of support that woman is going to be receiving from her spouse. Or even if based on what they provided you already, making statements that you've perceived, like, well, it seems like your family has supported you previously. Have you discussed with them already your feelings about, whatever it is that you're talking about? And then exploring other psychosocial factors. So your biggest fear, concern about having a son with hemophilia. Maybe they haven't articulated that or even thought about that before. And then based on the information they're giving you, being able to evaluate the actual words they're saying, their verbal cues, and their nonverbals. So, of course, crying or perhaps avoiding eye contact with you, their tone, if they're very quiet, or repeated phrases and words, obviously indicating something is very important or something that's bothering them, perhaps. Being able to use all of that into how they're figuring out their emotional state. And then once you have addressing those and being able to validate and normalize appropriate feelings that they're expressing. So perhaps you appear to feel guilt because your son inherited hemophilia from you. This is normal reaction, commonly expressed by mothers in a similar situation, letting them know that they're not alone. And then you can help them feel supported, not just by agreeing with them, but actually taking the next step and helping them secure next step plans, and are helping them plan for whatever those next steps might be for them, and providing additional resources, again, based on the way that they best want to be supported, providing in-person or online support groups, meeting people face-to-face from other people who have had previously agreed to do so, and of course, brochures. And then the last component is case management. Case management is very important, sort of like the packaging that's wraps up the whole session together, because it occurs before, during, and after your time with each and every patient. This is going to help you provide that information most efficiently and effectively, and ensures that your patient gets everything that they need from you. So beforehand, collecting standard information, medical records, the reason why they were referred to you from the beginning, and their current clinical picture. And then during, being able to consider your time available, talking about informed consent for tests, establishing a plan, that anticipatory guidance, and then summarizing the session for them. Some things that happen. So your results should take approximately 2 weeks, regardless of the result. I'll typically call patients with their results as soon as they're available. Are you comfortable with this plan? So making a plan and making sure they agree with the plan. Or if a friend or family member asks you to explain or discuss what we talked about today, how would you explain it to them? So before them leaving, you're reevaluating the fact that what understanding do they have about the information you've provided them that day, and kind of summarizing it before they go. And then afterwards, Very important, being able to document everything as soon as possible so nothing important is forgotten, coordinating necessary follow-up, and then making yourself available in a way that you feel comfortable. Not everyone wants to give their cell phone numbers out, but just making, emails or whatever way so that they know that you are available for them and are supporting them. So, in summary, genetic counselors value client autonomy, confidentiality, and privacy, as well as non-directiveness throughout the genetic counseling process. The process has 6 main components that will vary in practice depending on client-specific needs. Not every patient will benefit from genetic testing. Psychosocial assessment and counseling is a critical component as your patient and client's feelings and perceptions impact how they understand the information you're providing. And appropriate case management allows your clients to receive the most effective and efficient genetic counseling possible.